division directors, and thank you. And we'll have a few other guests joining us here shortly as well. So we will dig into things. First off, I want to announce that we are very excited to have two ASL interpreters with us here today. They should be appearing on your screens. Actually, I don't know if they are, Marina. You may have to promote them to panelists.
I will look for them and we'll do that, absolutely.
Yes, their names are Adrian Baskins and Audrey Reyna.
Great.
So while we get that started, yes, we are so excited to be offering this. Once you see Adrian and Audrey appear on your screens, if you hover over their pictures, you should be able to click in the right-hand corner and pin them to make them appear larger on your screen if you wish. So please know that you do have the ability to change your view and make sure that you can view our interpreters throughout this presentation. If you have any questions about that, please chat the presenters and we can make sure that you are all set up. Okay, and then in addition to that, we do have closed captioning enabled for this event, although as an individual participant, you do have to turn those subtitles on yourself. So if you would like to have closed captioning available, click the caret to, let's see if I can read my own screen. Click the caret to the right of the button and, so at the bottom of your Zoom window, I see you should be able to turn on those subtitles, and then you can choose different languages if you wish by clicking on the caret to the right of that button. And again, if you're having any technical difficulties, either with accessing our translators or using closed captioning, please message Angelina, who is on the call, or any of us presenters, and we'll be happy to help you. And I just want to check in with Marina. Were we able to get Adrian and Audrey?
Not yet. I don't believe they're here yet.
Oh, okay. Well, we'll continue to work on that, and maybe Angelina, you can send out a message, or Marina, once we do have our interpreters with us. So that'll be available. Okay, well, let's move on then to today's agenda. We are going to go through what is the purpose and the intended outcomes of today's town hall. You also asked, for those of you who attended our first town hall, you also asked lots of wonderful questions and had good comments. And so we are going to address some of those here today. We're going to show you different ways to stay connected with us and provide some quick updates from the BHA. And then in terms of our hot topics for today, we're going to talk a little bit about BHA's strategic plan that was recently launched and give some highlights from that plan. We have Kristen Ingstrup, who just joined us and is going to talk about workforce development, which we know is a huge issue in behavioral health, and talk about some of the initiatives that are happening within the BHA in that area. And then finally, we're going to touch on BHA's, Behavioral Health Administrative Service Organizations, and provide a brief update on that initiative. We did touch on the BHA's last town hall, and so wanted to provide a brief update on that. But before we get too far along, we wanted to do a fun check-in with all of you. How are you showing up in this space? And which of these squirrels represents how you're feeling right now? So I think we have a simple poll that we're going to pull up, and you can just tell us which one represents how you're feeling and showing up in today's space. Squirrel number 1, 2, 3, or 4. And Angelina or Marina, I think we have a poll that we can have people vote on. Danielle's a 4. She went ahead and put it in the chat. Which squirrel are you? There you go. You should all have your poll now. So go ahead and vote, and we'll see what the energy is in the room today. All right. Let's go ahead and see the results here. I'm really curious. Okay, aha. So we're kind of split between 3 and 4, which I think I'm split between 3 and 4 as well. I'm feeling a little bit about both of those things. And we have a little bit of 1 and 2 in us as well. So great. Thanks all. Okay, let's move on to the next slide. Oh no, I'm controlling the slides. Okay, so a little bit about these town halls. This is just our second monthly BHA town hall. So wanted to review really what the purpose is of these monthly meetings and the intended outcomes. So really these town halls are meant to give all of our stakeholders an ongoing opportunity to hear directly from us at the BHA about important updates and progress that we are making. We want to provide for you a high-level overview of what the BHA is up to and how you can engage more specifically based on your interests. So as you may, for those of you who have engaged with us over the last several months, you may know we have at any point in time a number of stakeholder engagement opportunities happening around more specific initiatives. These town halls are not meant to take the place of those more specific stakeholder engagement opportunities, but rather in these town halls, we will make sure you are aware and connected to all the different opportunities to provide input or feedback on specific policies or approaches. All of these sessions are open to the public and our partners. And at the end of the session, we will welcome your input on other topics you would like us to touch on in future town halls. In terms of how we're going to engage with you here today, please feel free to utilize the chat feature or the Q&A feature. Our wonderful team here will be monitoring that, excuse me, throughout the town hall. We're also going to pause throughout the town hall to take any questions and interact with you. Of course, all of that is time permitting, depending on how many questions you throw at us here today. If we can't respond to your questions in real time, there are several other ways we hope to be responsive to you. First, which we're going to do in a little bit here today, we're going to take time at the beginning of each town hall to talk about some of the questions that came up during the last session and respond to some key questions. We also are going to continue to maintain a frequently asked questions document that will be posted to our website. So questions and comments that are coming through our town halls and other venues, we take that as information about what our stakeholders are wondering about and want to hear more about. And we hope to be responsive through our FAQs and other resources. Finally, we are recording today's town hall. All of our town halls, the recordings, the slides, and any other resources will be posted to our BHA website shortly after the event. And the link is there, which I know you can't click on in real time, but we'll try to place as many links as we can in the chat. Okay, so that's how we'll interact with you today during today's town hall. In terms of what you asked during the last session on January 25th, some of the requests were around making sure these town halls are more interactive. So again, we are going to do our best. We know there is a lot of interest in what we are doing at the BHA. So we hope that through the chats, the Q&A, other resources, and pausing throughout today's session, that you will feel like these town halls are a place to interact with us. And if it still doesn't feel interactive enough, please give us that feedback, and we'll keep thinking about ways to make sure that we are being responsive to all of you. Secondly, we got quite a few questions last session that we thought would be a really good fit for our provider and crisis convenings. So these are also monthly meetings that we hold that are more specific to behavioral health providers. So those topics that came up, we have shared with our statewide programs team, which develops the agenda for those convenings. Some examples that came through last town hall were questions around quality reporting measures and having more targeted conversations with hospitals and emergency rooms, especially around upcoming changes to the 2765 regulations. So we have made sure to communicate that to some of our other program teams to touch on during those provider meetings. So please know that that has happened. We also touched on, as I mentioned, the BHAs during our last session. We know this is a hot topic right now. Again, those are the Behavioral Health Administrative Service Organizations, the new regional entities that the BHA will be standing up. So we got a lot of good questions around that piece. As you can see here now on our BHA website, we have a frequently asked questions document specifically around the BHAs that responds to some of the questions that came through. We also held a BASO community forum. And so that recording, as well as the slides, go much more in depth than we were able to during the town hall on the topic of BASOs and where the BHA is in terms of our planning. So the recording and the slides from that forum are also available on our website. And I think Marina or Angelina will be, yes, thank you, pasting those slides into our chat for you there. Finally, we also got some really great questions around BASOs, although some of them we aren't able to answer yet because we are having at least another year of planning around BASOs, but we wanted to acknowledge questions around funding streams, around integrating and consolidating MSOs and ASOs and other existing entities into the new structure. Those are all wonderful questions and things that we will continue to engage with you around during the next kind of planning year around BASOs. So much more to come around BASOs and what that transition will look like. So keep those questions coming. We are just not able to answer all of them right now since we are just in the beginning design phases of that topic. You also had some good questions around care coordination as well as the continuum of care, especially for youth with complex needs. And so we have added those as future topics for town halls. We know, again, those are big topics and things that the BHA is prioritizing over the next year or two. And so we will be sure to touch on those in future town halls. So that's a snapshot of some of the questions and comments that we received from all of you during the last town hall. Also, quick update. I know Tom Miller is here, so Tom, you can feel free to jump in if you'd like around the rules. Tom did present at the last town hall around the major rule revision and rule restructure that the BHA is undergoing. And as a recap, Tom and his team have held 5 public town halls, have engaged with hundreds of stakeholders, received over 600 comments on those rules and regulations. And they recently held a rule replay. So we are providing the link there that again provides lots of resources around the new regulations that the BHA has drafted and is putting out to the public. Tom, I'll just pause. I don't mean to put you on the spot, but do you have anything else you want to add around rules at this time?
Thank you, Yumiko. You're not putting me on the spot at all. I'm pleased to speak to the group this afternoon. For those that don't know me, Tom Miller, I'm the Division Director of the Quality and Standards Division at the BHA. My pronouns are he, him, his. You did a fantastic job. The only thing I would add, Yumiko, is that that rule replay was on the 15th. That was last Wednesday, if memory serves. I think we had over 200 participants in that. And what we attempted to accomplish in the rule replay was the changes that we incorporated in those draft rules based on stakeholder feedback. So we attempted to highlight the changes chapter by chapter of the very valuable input that we got from all those stakeholders. We have submitted those draft rules to the State Board of Human Services, and we will do what's called a rule layover reading on March 3rd. So that essentially means that we are just explaining to the board what these rules are intended to do. The first official reading will be at the next board hearing in the following month. So I think that in addition to your excellent comments, rounds out all the rule updates.
Okay, wonderful. Thank you so much, Tom. And huge kudos to Tom and the entire licensing and standards team for not only engaging with our stakeholders and receiving all this feedback, but actually acting upon it and incorporating it as possible and appropriate. So thanks so much, Tom. I also want to announce we have a new feature on our BHA website that I hope will be very helpful to all of you. We now have a BHA stakeholder engagement calendar. Here is a snapshot of the month of February. Again, you can see how busy we are and how dedicated we are to engaging with all of you. So please check it out. We'll put the link in the chat. If you click on any of these links, it should pop up the links to either join a Zoom call or to register for the call. So again, we hope this is a one-stop shop place where you can go and see all that's happening, all of our externally facing meetings and ways to engage with us. So you see the rule replay on there. We have our advisory council meeting tomorrow and a number of other meetings coming up if you want to engage with us even further. And then again, just some additional ways to stay connected. We have a fabulous newsletter that goes out every month. That is a great way to stay in touch and stay updated on some of the big things that are happening. Funding opportunities are there, highlights of different events and things that are going on around the BHA are within that newsletter. So please make sure that you sign up and subscribe. We also always have an open feedback form on our BHA website. So if you'd like to submit any questions or comments or feedback to us in writing, that form is always available to you. I also just highlighted a couple of meetings that are regularly scheduled. So I already mentioned we have monthly convenings specifically for providers and crisis providers. Of course, anyone can attend those meetings, but the content is more specific to what we think is most significant to providers. We also have these wonderful monthly BHA town halls where we provide a higher level update of what's going on at the BHA. We have regular BHA advisory council meetings that are open to the public. And again, that is where we discuss a lot of the big topics happening in behavioral health and receive feedback and advice from our wonderful lived experience council. I think I saw a few of our members on the call here today. And then finally, we will highlight throughout this session and all future BHA town halls specific additional stakeholder engagement opportunities around different targeted initiatives that you may be interested in. So that's how to stay connected with us. Before I move on to our first hot topic of the strategic plan, I think I will just pause and check in with my colleagues and see if there's any questions or comments we want to address before we move on.
So Yumiko, there was a question in the chat about if there's going to be any new information shared today compared to what was discussed last week in the crisis convening. And I'm not sure if you or one of our other folks wants to address that.
Sure, I did attend the crisis convening or the provider and crisis convening. It will be different. Again, I think the information provided in that convening is more targeted to providers, what we think is more significant to providers. So we talked about things like how to bill and the different codes for peer support services. We highlighted some various technology projects that are more specifically for our providers and other things. There will be some overlap, but today's session is more for all of our stakeholders generally. You'll find it's a bit more high level. As I mentioned in the agenda, we're going to touch specifically on our strategic plan and on workforce development here today. So it will be different, and I think you'll continue to see some difference between those two forums.
There was one more thing I just want to point out for everyone. So we don't actually send, the BHA does not actually send out invitations for this town hall. If you register on the town hall website, which I will put again in the chat, once you register via Zoom, it should allow you to download a calendar invitation for the sessions. So give that a try. I saw that someone put their email in the chat and requested we send an invite, but we don't actually do that. So hopefully the Zoom thing helps. Feel free to reach out to any of us directly if you're having trouble or problems with that, and we can help you troubleshoot.
Great. Okay, thank you. Keep the questions and comments coming. And I'm going to move along to our first hot topic, which is the BHA strategic plan. At the end of last month, January, the BHA released its first 3-year strategic plan. And we're putting the link in the chat there if you would like to read the document. It is quite a substantive document for a few reasons. One is the BHA is new. Although it was a long history and there's a long foundation in terms of how we got to where we are today. As a new state entity, we are very new, just several months old. And so we wanted to take some space within that document to reintroduce ourselves to you, who we are, what we do, what our values are, and what our priorities are. As you can see here, we also spent some time talking about all the different things over the last several years that got us to where we are. Key legislation, the Behavioral Health Task Force, a statewide needs assessment. So years of work and hundreds and thousands of people in Colorado actually that contributed to the creation of the BHA and the creation of our priorities. In the strategic plan, I think we also do a good job of explaining succinctly what's going to be different about the BHA. I think there's a lot of excitement around having a new statewide entity that is really focused on behavioral health, but we are also focused on addressing some specific things within our behavioral health system. So this graphic here attempts to summarize some of those big things that we are trying to do, which is namely putting people first and foremost. Ensuring that there is a unified, consistent strategy, also funding and data across our systems, and ensuring that there's coordination as well across our systems. We introduce within the strategic plan what we refer to as the behavioral health ecosystem. So within the BHA, we think of our work much more broadly than the traditional conception of behavioral health, which is really focused on service delivery and treatment. We think that in order to truly make a generational impact, we need to work much further upstream in terms of addressing and naming social and institutional inequities and the root causes of health inequities within our society. So we try to kind of broaden the scope of when we talk about behavioral health. We are again talking about the underlying conditions that lead to health inequities, just as much as we are talking about services, treatment, crisis, and recovery. So here's a nice graphic that illustrates what we believe is the full scope of behavioral health in our state. And that means focusing on things like community-based prevention and social determinants of health, as well as the more traditional continuum of care in behavioral health. Everything we do at the BHA is rooted in our values of equity, naming the root causes, again, of injustice and actually acting upon them. Truth, being transparent and accurate when we talk to all of you, our stakeholders. Leaning into community-informed practice, recognizing all of you as the experts and needing to partner with us in creating our future behavioral health system. Creating generational impact, not just tweaking the system at the edges, but really truly trying to make an impact that will last for many years to come. And then, of course, collaboration. And this town hall is just one example of how we hope to collaborate with all of you moving forward in this work. Underneath those value commitments, we have what is called our BHA pillars. These are the 6 functions of a well-functioning behavioral health system that the BHA is hoping to address. And I mention these 6 pillars because this is how our strategic plan is structured and also how we think about the work within the BHA. Within each of these pillars are various priorities and strategies that we are focusing on over the next 3 years. So when you take a look at our strategic plan, you will see it laid out that way in terms of values, then looking at pillars, and within each pillar, priorities and strategies. So as we go through some of the other hot topics today, we will illustrate to you how all of these things come together. And we'll go to our first strategy spotlight, which is highlighting the pillar of access. This is a huge one for us at the BHA. In a nutshell, we believe that all people in Colorado deserve access to a continuum of behavioral health services and to be connected to those services when they need them. Within the pillar of access, we have the priority that was established by the Behavioral Health Task Force to expand and enhance the crisis services system that allows people to reduce reliance on police for behavioral health emergencies. And then within that priority, we have a key strategy to implement and evaluate crisis resolution team pilots. And so here with us today, we have Megan Lee, who is a wonderful member of our crisis team and is heading up the initiative around crisis resolution teams. And I invited her to just say a few words. We're hoping throughout these town halls to really put a spotlight on the various programs and strategies that are highlighted within our plan. So Megan, if you're able to come off mute and just say a few words about the crisis resolution teams and where they sit within our strategic plan.
Sure. Good afternoon. Thanks, Yumika, for inviting me. I'm really excited about our crisis resolution teams. They are in 19 Colorado counties, unfortunately not serving the whole state as it's just a pilot. But as we learn about how effective these teams are, we really hope to expand it into more Colorado counties. The crisis resolution teams are really meant to be post-acute crisis stabilization for children, youth, and their families. Really focusing on that family stabilization. So it's the treatment of the whole entire unit with really wraparound support and care. So thinking about all of the different factors that may have led an individual in the family or the whole family unit to be in crisis, and how in a short time frame, like 6 to 8 weeks, the teams can work on stabilizing some of those factors to see some functional improvements in what's going on with the family. So these teams are not meant to like get rid of an individual's symptoms or be the only sort of treatment option that a family might ever need, but really get some tangible functional supports in place and then connect the family with community-based supports that are meaningful for them. So that could be ongoing outpatient therapy, or it could be like connecting the family to other families and get support in, alleviating some social isolation. So the families have access to a lot of different services. Could be case management, peer support or family advocacy, individual or family or group therapy, potentially some medication management if that would help an individual or members of the family stay out of higher levels of care. And the teams are comprised of multidisciplinary professionals and paraprofessionals, and see the family lots and lots of times in any given week. So we want at least 3 to 4 times a week, but really could be every day of the week or multiple times in a week, because so many different, or multiple times in a day, because so many different services are being offered. And so a family could have like a group therapy and an individual therapy and meet with their peer and get some medication management all within 1 week. So it's really rapid stabilization, and then on to sort of a lower level of intervention when the family feels like they have a good handle on the things that led them to be in the position where they needed to outreach crisis services. We are studying the outcomes of these programs to really understand, are they working, how they're working, what could be improved upon, and then hopefully implement this more long-term and in more counties throughout the state.
Great, thank you so much, Megan. This is one key strategy we highlighted in the plan that I'm really excited about. Prior to coming to the BHA, I worked in child welfare reform, and just the concept of wrapping around families, trying to stabilize and keep them at home in their own communities and connected to services is just so important. And so thank you so much for all your work, Megan, and for being a leader in this work. I think it also ties back to one of the questions we received at the last town hall, which was really focusing on children and youth with high acuity needs and what we're doing at the BHA to really ensure access to services for that population. Great, so thank you, Megan, and we hope to do this throughout all of our town halls. Highlight, again, what we think are really innovative programs and approaches throughout the different pillars of our strategic plan. The second one I wanted to spotlight here real quickly because it is timely is around universal contracting provisions. This one is also related to access, ensuring all people have access to a continuum of behavioral health services, but it's under the priority of addressing fractures in our system, especially between mental health and substance use disorder. And the strategy is really to develop universal contracting provisions in collaboration with Medicaid and many other stakeholders so that any state agency, when they are procuring services and supports related to behavioral health, will be using a consistent set of standards and metrics. I wanted to mention this one in particular because the BHA all throughout March is launching a roadshow. We are going out on the road to talk to providers, to talk to stakeholders in partnership with our Medicaid agency, Healthcare Policy and Financing, to really make sure that we are living into our values of community-informed practice and collaboration in the development of these universal contracting provisions. And I think we'll move on next to workforce development, which is a pillar all in of itself. But before we do that, and I turn things over to Kristen, I'm going to check in with my colleagues to see if there's any chats or questions that have come through that we would be able to address.
Hi, Yumiko. This is Marina. Thank you. There is a question that came in. I'll address the one that's in the Q&A area. And the question was, I think it was when Megan was presenting, and the question says, will this be for older family members too?
Hi, I'm sorry, what I heard only part of that question. Will this be for
Older family members too?
Oh, sure. Yeah. So it's really self-defined crisis and self-defined family. It would be anyone who is sort of in the household or intimately involved with the family unit. There's really no strict definition. It would be like who really has an influence on the wellness of the family.
Thank you, Megan.
And then Megan, I also saw a question about which counties, and I don't know if you know that off the top of your head, or if there is a resource link that we can link people to find out more about the pilot.
Yes, I can put a link in the chat when we move on to the next section. And I can also just say it is in Region 1, Delta, Montrose, and Mesa. Region 2, Weld. 3, Adams, Arapahoe, Douglas, Elbert. 4, Fremont, Chaffee, Lake, Custer. 5 is Denver. 6 is Jefferson, Gilpin, Clear Creek, Boulder, Broomfield. And 7 is El Paso, but I'm happy to put that in the chat for reference.
Perfect. Thanks so much, Megan. Okay, well, next up, I'm going to turn things over to another wonderful colleague, Kristen Ingstrup, who is helping to head up a huge area of need within the behavioral health field around workforce development. So Kristen, I'm going to turn things over to you.
Great. It's wonderful to be here with you all today. As Yumiko mentioned, I'm part of our workforce development team, which is really working across many agencies to make sure we have an appropriate amount of workforce to meet the needs of the people of Colorado. Can you go to the next slide? And so I thought I'd start off talking today about why is workforce a pillar in itself and what is the need in this state. And so our Colorado Health Systems Directory tracks the number of licensed clinicians that we have in different areas through the Department of Public Health and Environment. And so we see in 2022, out of 64 counties, 6 don't have a licensed behavioral health clinician. And additionally, on top of that, there are 15 more counties that have less than 10 behavioral health clinicians. And we know that there are many different settings in which behavioral health clinicians are needed. And so it's concerning when we see statistics like 16 counties don't have a licensed clinical social worker and 22 rural counties in the state didn't have an active psychologist. And one of the things that we're really paying close attention to is that since 2020, we're seeing approximately a 10% drop in licensed behavioral health clinicians, which the pandemic has only increased the demand for behavioral health support. And we've especially seen that behavioral health has experienced greatly increased demand with a change in between 2019 and 2022 of almost 152% increase in demand for behavioral health compared to 34% baseline across all industries. And so I'm not saying this to be all doom and gloom, but as we think about what it means to have a behavioral health system that is accessible, trusted, and equitable, the lack of workforce, especially in regions of the state that have been experiencing need for more clinicians, really impacts the access to care as well as the quality of services. And so, next slide, please. We really are listening to the stakeholders and the consumers out there and hearing that this is a great demand. And so one of our strategic plan initiatives is having a high quality, trained, resource, and culturally responsive and diverse behavioral health workforce across Colorado to support this improved health and access. And so we are looking at expanding the capacity both for the licensed and unlicensed workforce. And I'll speak a little bit more about what some of those unlicensed paraprofessionals can add to behavioral health teams, and especially making sure that we are having a diverse workforce, including peer support professionals, because we know that the lack of diversity and representation impacts access to services, and it also represents untapped pipelines for talent. And so making sure that we have a workforce that reflects the people that they serve. Next slide. And so a few years ago, we had a behavioral health task force who made up from people all across the state and representing diverse perspectives. We talked about what are our needs here. And so the number one need is that there aren't enough providers and there aren't strong enough incentives for recruitment and retention. So both current workforce as well as thinking about future workforce, how are we creating an environment where people want to be a part of the behavioral health system and can utilize their strengths to help deliver services. Additionally, we heard that there isn't enough training or regulation, and I'll qualify that statement by saying that it's mostly around paraprofessional roles, such as peers. We're just wanting to make sure that we're taking a cohesive state approach to regulating those professions, but also recognizing that there are other behavioral health professions that are face some extreme administrative burdens. So really trying to make sure that we're walking that right balance in having a workforce that is able to do their job with appropriate oversight. Next slide. And so we were fortunate enough last year through the one-time federal stimulus funding to receive a significant investment in behavioral health workforce development through Senate Bill 22-181. And so overall right now we have over $50 million in workforce funding that's out in the field, which is really exciting to see these initiatives being funded specifically for behavioral health workforce. Additionally, there is also $15 million that went to the community college system to help develop curriculum for behavioral health pathways, as well as $20 million to the Colorado Health Service Corps, which represents the last icon on this timeline around offering loans, forgiveness, and scholarships to to clinicians that serve in mental health professional shortage areas. But additionally, Senate Bill 22-181 really allows us to promote the profession to different communities and really be thinking about how are we making people aware of behavioral health as a career when maybe that's not something that you've engaged with previously. Additionally, we're looking to create opportunities to grow in the field through strengthening career pipelines, as well as some grant opportunities that we'll be giving. And like I mentioned before, building a coalition of peer support specialists and co-designing with the peer community how we can better incorporate them into existing behavioral health services. And additionally, we also hear the need to keep things local and understanding that the workforce tends to, but generally when people are going to school, they are, especially in the community college system, they like the place that they're in and hope to stay there. And so how can we incentivize people not to all move to the Denver metro area where there may be more jobs, but encourage job opportunities in rural parts of the state, as well as educational opportunities in under-resourced parts of the state. So next slide. Some of you may be aware of the September 2022 plan that we released on strengthening the behavioral health workforce in Colorado, and how that is really an approach to community partnership. And so I won't go into extreme levels of detail on these initiatives, but I'll just say at a high level, part of this is will be around increasing paraprofessional opportunities to support behavioral health teams. It's important for licensed clinicians to work at the top of their licensure, as well as making sure that we are incorporating people who have lived experience and reflect the communities that they serve in the behavioral health workforce, and making sure that there are tiered opportunities for them to advance in those careers. And so I'll discuss in a little bit some of the peer support grants that we'll be launching, and I forgot a word on the second bullet, but it's launching the Behavioral Health AIDS program, which is modeled after a highly successful paraprofessional role in Alaska that really looked at expanding access to tribal communities and as well as frontier communities. And I will put a link to the workforce plan in the chat, just looking over there. Thanks, Angelina, for adding that. So as I mentioned, one of our initiatives is around strengthening the current workforce, recognizing that with the extreme increase in demand for behavioral health services as a result of COVID, as well as economic drivers, we're going to be offering retention and recruitment grants that are now currently open. I'll talk a little bit more about that. Some of you may have heard already that we have $14.5 million in grant opportunities for retention and recruitment of the substance use disorder workforce. Specifically, those are currently available on the vendor self-service website, and we are accepting applications still. We will also be offering a behavioral health learning nexus that is really a way to connect individuals to different types of behavioral health training. So if you think of registering at a hotel as a learning management system, this learning nexus will be a little bit like going to Expedia and seeing what different hotels are out there and which one works best for you. So this will be really a way to help both the current and the future workforce get a flavor of what you need to know around training. And so some of those trainings will also be made available to different allied roles, such as firefighters, first responders, police officers, and officers of the peace. So more to come on that in the later half of this year. As far as the future workforce, we will be launching career pipeline development grants, acknowledging that there are community organizations that are out there doing great work. We really want to scale that up and provide opportunities to strengthen the homegrown pipeline. And so those grants will be coming out by June, as well as paid internship and pre-licensure stipends, because a lot of times with clinicians who completed their master's program and are going into supervised work, there are financial barriers for them to complete that work. So we're really thinking about, for first generation college students and for clinicians who represent some of the priority populations that are outlined in Senate Bill 22-181, how can we provide things like transportation, wraparound services, also acknowledging that housing and the rising cost of living in Colorado can be a huge barrier. So just thinking creatively about how can we support clinicians and becoming licensed. Additionally, we'll be looking at how to incentivize apprenticeships in partnership with the Colorado Department of Labor and Employment. If you aren't aware, Colorado recently launched the first behavioral health apprenticeships in the state, which is very exciting, and we're hoping to support those efforts and incentivize employers to go on. Next slide. And so, as I mentioned, one piece of this are the workforce retention and recruitment grants. As I noted, 181 really calls on us to expand and strengthen the behavioral healthcare provider workforce in Colorado because that will help aid in the response to behavioral health issues, especially among historically under-resourced communities. And so we really recognize that it's necessary to recruit, support, and retain skilled workers in mental health, substance use, crisis services, and care coordination to ensure equitable access to care. As I mentioned, $4.5 million is currently available under the Behavioral Health Workforce Recruitment, Retention and Recruitment Grant to support some of these innovative strategies. And in addition, there is that $14.5 million for substance use disorder behavioral health workforce only. And so I would really encourage anyone who employs behavioral health professionals to take a look at that and see if some of these funds can help stabilize a workforce that has been really rocked by the impacts of COVID. Next slide. So I did mention the peer paraprofessional workforce, and as we were writing our original September 2022 plan, we realized that we needed further stakeholder engagement was needed to develop a comprehensive strategy to outline everything in 181, including recruitment, certification, career pathway development, professional standards, and ensuring appropriate training and supervision. And so we have an investment of $5.9 million in the peer support workforce, and these will really focus on creating sustainable growth and quality improvements in the peer support field, which is also really an overarching focus of the $36 million in total, is how are we making these initiatives sustainable after this one-time funding ends. And so we just actually last week released a plan to increase the number of peers, establishing workforce standards, increasing career opportunities, and developing tracking to make sure we know where peers are and where they're serving. And so because we really want the future of peer support professionals to be self-defined to some extent and really co-designed with the Behavioral Health Administration, we're making the bulk of that funding available through peer support workforce grants that we anticipate launching in June as well. So I think that's it for me. I'll check the chat to see if there's anything in there.
Yep, Kristen, I think there's a couple questions specifically around workforce. Marina, do you happen to have those? And just as a reminder to folks, given that this is only a 1-hour town hall, if we don't get to your questions in real time today, we will absolutely find other ways to be responsive, including at our next town hall meeting. So Marina, what questions are there for Kristen?
Yes, thank you, Yumiko. So the one question is the BHA working with HCPF to update the Medicaid billing manual to include paraprofessionals and/or behavioral health aides? Currently, the only persons that do not have a 4-year higher education degree or higher that are considered billable are peers.
That's a great question. And I think that workforce development in particular, one of the defining qualities of our team is really cross-agency and working with a lot of stakeholders too, and to make sure that this is a very collaborative approach. So since the behavioral health aide / assistant role will be a new role for the state of Colorado, we've convened a multidisciplinary work group that does include HCPF and are talking with them to look at Alaska's Medicaid policies and how that can apply to the state of Colorado, although those discussions are very much in the early stages. And so anyway, I think those conversations are evolving, and we'll hopefully be able to update you as we learn more about what this looks like.
Thank you, Kristen. And if we have time for one more question, the question is, considering, and this might actually be for Tom Miller, considering workforce issues, did I hear correctly on last week's rule replay that a licensed behavioral health entity will be limited to 50% unlicensed providers within their organization?
I certainly don't want to take too much time in this particular forum to do rules, so that particular person is welcome to reach directly out to me. There are different parts of the rules that have allowances for unlicensed staff who are candidates for their particular individual licensure if they are practicing under the direct supervision of a licensed practitioner. What we believe is that that allows additional flexibility at the provider level. Now, that's not necessarily a change from the current rule, but I do believe that strikes a balance between some groups that wish not to have any unlicensed professionals providing direct services and those that do wish to have more unlicensed professionals practicing within those specific service levels. But again, feel free to reach directly out to me and I can walk you through the rules. Thank you.
Thanks, Tom. Okay, great. Thank you so much, Kristen. I think there's a few other questions coming through. Again, if we are able to respond here today, great. If not, we'll be sure to find other ways, either through FAQs or addressing them at the next session. Our last topic for today is to just provide a brief update around our Behavioral Health Administrative Services Organizations, or the BHAs. This is a topic that has been talked about in several other forums. So again, the purpose here is to just ground us in what the BHAs are and connect you to various resources if you would like to learn more about where we are in that design process. Again, the BHAs are connected to the pillar of access within our strategic plan. Similar to universal contracting provisions, it's really under the priority of addressing fractures in our current system. And the key strategy is to create these BHAs, new regional entities that will consolidate current various other entities in order to expand regional access to whole person healthcare, including mental health, substance use, crisis, care coordination, and other essential safety net services. So the BHAs are really a key piece of the future behavioral health system in Colorado. And that's, of course, why there is so much interest in this topic from our stakeholders. As many of you hopefully know, and we talked a little bit about on the last town hall, one of the key questions we are wrestling with right now is how many BHA regions should there be, and where do we draw the boundaries around those regions? And so what you can see here on the screen are 3 different scenarios that the BHA has been presenting to our stakeholders, talking about the different pros and cons between these different scenarios, looking at a lot of data to understand who are in these regions, what the behavioral health needs are, and how we create a more equitable system across our entire state. So these are the various scenarios we've been looking at. Relatively new to our analysis is we've started to look at the possibility of 3 BHA regions. So you can see here one of the scenarios, additional scenarios that we are looking at. And this is really based on a lot of the feedback and input that we have been hearing from all of you. We don't have really the space within this town hall to go into a lot of depth, but we are going to link you to several links that are available on our website if you would like to learn more. Notably, we just went over the 3-region approach during our provider convening last week. And so we can link you to that if you would like to listen to the recording or look at the slides that really digs into this 3-region approach. We can also link you to our BHA stakeholder engagement session that was held a while back that really detailed the different scenarios of the 2-region BHAs and what our thinking is there. So again, this is where we are in trying to think through what is the best way to approach ensuring an equitable behavioral health system, and how do we approach this question of regional delivery and ensuring regional access to services. So Marina, Angelina, if you can help me put some of those links in the chat for folks who want to learn more about the BHAs and the different scenarios that are in front of us at this time. In those, and I should mention in those various recordings, we talk about timeline as well and some next steps. And that takes us near the end of our time here today. As we mentioned during the next town hall, some of the topics that we will likely highlight are around the behavioral health ecosystem, which we introduced very quickly here today, as well as the continuum of care. That's one of the questions that was posed during this town hall, is to really dig into what we mean by a comprehensive continuum of care, and for different populations like youth with high acuity needs. Another big topic that we can dive into is care coordination. That's one of the big pieces that is connected to the BOSOs around connecting people to different levels of care. And so that's another topic we will likely dig into. But if you have any other ideas that you would like to see, any other topics you'd like to see us highlight during these town halls, please feel free to chat us. We really love hearing from you, what's on your minds and what you would like to learn more about. So please utilize the chat now and let us know what else you want to learn more about during these sessions. And give Angelina and Marina a minute. I just threw out a bunch of links, and so they are working on gathering some of that information. When we post this PowerPoint, we can add some of those links in as well. There are lots and lots of links since we've been holding so many different meetings, but we'll make sure that that gets posted to our website along with these slides for you all. And with that, I think that takes us to the end of our town hall for today. We will continue to hold these meetings monthly. So our next town hall will be March 22nd, same time, same place. Be sure to check out that stakeholder engagement calendar for any other meetings or events that you may be interested in. And we look forward to continuing to engage with you all. So thank you for your questions and comments, and we'll be talking to you all again very soon. And thanks to all of our speakers here today as well. Bye-bye.
Yumiko, Elizabeth put a kind of last minute question in the chat. Can you chat back to that? Because I believe you know the answer.
About care coordination?
Yes.
Elizabeth, if you're still on, I think that's